Welcome back to the Reimagine Healthcare podcast. I'm your host, Noah Voles, coming to you once again from Phoenix, Oregon. In our previous episodes, we've talked about Jackson Care Connect and All Care Health, the two coordinated care organizations that serve Oregon Health Plan members in Southern Oregon. We've explored how their structure as community-governed, mission-driven nonprofits enables them to invest in things like housing, transportation, and social supports that traditional insurance companies would never fund. But here's the thing about CCOs. They don't actually deliver healthcare directly. They're the payers. They manage the funding and coordinate the system. The actual care gets delivered by provider organizations across Southern Oregon. You can have all the enlightened funding mechanisms in the world, but if the clinics and hospitals delivering care are still operating in silos, treating physical health and mental health as separate domains, patients still fall through the cracks. Today, we're going to talk about one of the most important provider organizations in our region, Clinica Health Center, and specifically how they're reimagining the relationship between primary care and mental health. What they're doing is deceptively simple, and yet it's radical enough that it challenges fundamental assumptions about how healthcare is organized in America. And it matters for everyone, not just Oregon Health Plan members, because the problem they're solving affects all of us. Let me paint you a picture. You visit your primary care doctor, complaining of persistent fatigue and difficulty sleeping. Blood work comes back normal. Your thyroid's fine. No anemia. Everything looks good on paper. Your doctor mentions that stress might be a factor and suggests you try to relax more. Maybe they hand you a pamphlet about sleep hygiene or suggest you look into therapy. You leave with no concrete help, your symptoms unchanged, wondering if you imagine the whole thing or if your doctor just doesn't take you seriously. This scenario plays out thousands of times daily across American healthcare. And here's what the research tells us. Up to 70% of primary care visits have behavioral health components, anxiety affecting physical symptoms, depression presenting as chronic pain, stress exacerbating diabetes management, grief manifesting as unexplained fatigue. The mind and body aren't separate. We all know this intuitively, and yet our healthcare system treats them as if they occupy different planets. Traditional healthcare operates in silos. Primary care handles physical health. Mental health specialists handle psychological issues. The two rarely communicate effectively, and patients fall through the cracks in between. The consequences are significant. People with untreated depression have worse outcomes for diabetes, heart disease, and chronic pain. Anxiety complicates recovery from surgery and illness. Substance use affects medication adherence and chronic disease management. Grief and trauma manifest as physical symptoms that confound diagnosis. Nationally, an estimated 19.9% of behavioral health needs go completely unmet among adults and adolescents. But even when people do seek mental health care, accessing it requires navigating a separate system. You have to find a therapist who's accepting new patients. You have to confirm insurance coverage. And good luck if you're trying to figure out whether your plan actually covers mental health at the same rate as physical health. You have to schedule appointments that work with your job, which is often difficult because many therapists don't have evening or weekend hours. And then you have to explain your entire medical history to someone who doesn't talk to your primary care doctor and has no access to your medical records. For many people, these barriers prove insurmountable. They continue seeing their primary care provider for symptoms that never quite resolve, cycling through medications and tests that address effects rather than causes, The doctor knows something's not right, but can't quite put their finger on it. The patient feels increasingly frustrated and unheard. Everyone's doing their best within a system that's structurally designed to keep mental and physical health separate. La Clinica Health Center has spent years building a different model. When you visit for that fatigue and insomnia, a behavioral health clinician might join your appointment, not weeks from now after you've secured a separate referral, but today in the same room, working alongside your primary care provider to address the whole picture. In 2022, La Clinica served 5,438 people through 34,546 behavioral health interactions. That's a nearly 40% increase over the previous year. And these aren't specialty mental health patients who came specifically seeking psychiatric care. These are primary care patients receiving whole person care that addresses both physical and behavioral health simultaneously. The model is called integrated behavioral health, and it operates on a simple premise. If behavioral health affects most primary care visits, then behavioral health should be part of primary care, not separate from it. La Clinica embeds behavioral health professionals directly into primary care teams. Behavioral health isn't a separate department you get referred to. It's part of your care team from the start. Here's how it works in practice. Integrated behavioral health clinicians have advanced training to work alongside primary care providers. They attend medical appointments, help patients set health goals, address mental health and substance use concerns, and connect patients to more intensive services when needed. Most importantly, they're available wherever La Clinica provides medical care. You can get help at a regular medical appointment or schedule separately. So if you're seeing your doctor for diabetes management and you mention that you've been feeling really anxious lately, the doctor can introduce you to the behavioral health clinician right then. It's what they call a warm handoff. You're not leaving with a phone number you might or might not call. You're meeting the person who can help you, and that initial connection dramatically increases the likelihood that you'll actually engage with mental health support. Behavioral health support specialists help patients navigate the healthcare system and work toward personal wellness goals. They coordinate with community mental health providers when more intensive services are needed, connect patients to wellness classes through the Learning Well, which is La Clinica's learning and support service, and link people with community resources for food, shelter, and transportation. This recognizes that mental health doesn't exist in a vacuum. If you're stressed because you don't know how you're going to pay rent this month, a therapy session alone isn't going to solve the problem. You need help navigating the actual concrete challenges affecting your well-being. Psychiatric services are integrated into the model through psychiatric mental health nurse practitioners and a child and adolescent psychiatrist. They consult with primary care providers on medication management and provide direct care when needed, again, all within the same system. So your primary care doctor isn't managing complex psychiatric medications in isolation. They're working with psychiatric specialists, but that collaboration is seamless and internal rather than requiring you to shuttle between disconnected providers. Medication-assisted treatment for opioid use disorder happens in primary care, not at a separate addiction clinic. This is huge. The stigma around addiction treatment keeps many people from seeking help. When you can work with your regular provider and behavioral health team on a comprehensive treatment plan in the same place you get your regular medical care, it normalizes addiction treatment as health care rather than marking it as something shameful and separate. At La Clinica's school-based health centers, behavioral health clinicians provide ongoing therapy to youth ages 5 to 18. Behavioral health support specialists, also called skills trainers, work in classrooms helping kids practice emotional regulation and coping skills. Think about what this means for a child struggling with anxiety or depression. They don't have to miss school to see a therapist. Their parents don't have to take time off work to drive them to appointments across town. The support is right there where the kid already is, integrated into their daily life. Even at dental visits, behavioral health support specialists are available to help patients with dental anxiety or other life challenges. This recognizes that stress affects oral health and vice versa. If someone has severe dental anxiety that's kept them from getting needed care for years, addressing that anxiety is a legitimate healthcare intervention, not a luxury add-on. In 2024, La Clinica introduced a significant enhancement to this integrated model, something called stepped care that's new to the Rogue Valley. Traditional healthcare often operates on a binary. You either need specialty mental health care or you don't. If your symptoms aren't severe enough for a psychiatrist or intensive therapy, you're left to manage on your own with vague advice to reduce stress. If your symptoms are severe, you might wait months for a specialist appointment. There's no middle ground, no gradual increase in support that matches the actual severity of what you're experiencing. La Clinica's stepped care model identifies 5 levels of behavioral health support, from simple lifestyle coaching to intensive residential care offered by partner organizations. All providers can use this framework when they encounter a patient needing behavioral health support, ensuring people get the right level of care quickly without either undertreating serious conditions or over-medicalizing normal life stress. Level 1 is self-management and lifestyle support, wellness education, stress management techniques, health coaching available to all patients. This is for people who are basically doing okay, but could benefit from some guidance on sleep hygiene, exercise, nutrition, or stress reduction. It's prevention-oriented, helping people build resilience before problems develop. Level 2 is brief intervention by behavioral health support specialists, problem-solving support, connection to resources, short-term coaching integrated into primary care. Maybe you're going through a difficult life transition, a divorce, a job loss, caring for an aging parent. You don't have a diagnosable mental health condition, but you're struggling, and some structured support would help. That's level 2. Level 3 is behavioral health clinician involvement, ongoing therapy for mental health or substance use concerns delivered within the primary care setting. This is for people with clinical anxiety, depression, PTSD, substance use disorders, conditions that benefit from regular therapy but don't necessarily require psychiatric medication or intensive treatment. Level 4 is psychiatric consultation and medication management, for conditions requiring specialized expertise still coordinated within the integrated care team. Severe depression, bipolar disorder, schizophrenia, complex trauma, conditions where psychiatric medications are likely necessary and need expert management. Level 5 is intensive specialty services, residential treatment, inpatient care, or intensive outpatient programs provided by partner organizations, with La Clinica maintaining care coordination. When someone needs 24-hour care or daily intensive programming, La Clinica connects them to specialists while staying involved to ensure continuity when they step back down to less intensive care. This framework ensures that resources match needs. Someone experiencing mild stress doesn't face the same barriers as someone with severe depression, but both get appropriate help quickly, and the model is self-correcting. If a lower intensity intervention isn't working, patients step up to more intensive care without starting over with a new provider. The behavioral health clinician who's been working with you at level 3 doesn't disappear when you need level 4 psychiatric support. They're still part of your team, coordinating with the psychiatrist. The long-term implications of this work for Jackson County are significant. First, it's preventing chronic disease complications. When depression is addressed alongside diabetes management, patients have better blood sugar control. When anxiety is treated during cardiac rehabilitation, recovery outcomes improve. These interventions prevent expensive complications years down the line. Second, it's reducing crisis care. Emergency rooms become the default mental health provider when primary care doesn't address behavioral health. By integrating services, La Clinica prevents crises that would otherwise result in expensive emergency interventions. People get help before they're in crisis, which is better for them and more cost-effective for the system. Third, it's building workforce capacity. The new Behavioral Health Fellowship trains clinicians specifically for integrated care models. As these professionals enter the workforce across Jackson County, they spread integrated care principles beyond La Clinica. Some will stay with La Clinica, but others will take what they've learned to other organizations, gradually transforming how behavioral health is delivered throughout the region. Fourth, it's normalizing mental health. When behavioral health is part of routine primary care rather than separate specialty care, stigma decreases. Families become comfortable discussing mental health alongside physical health. Kids growing up with this model won't see mental health as something shameful that you only address in a crisis. They'll see it as a normal part of staying healthy. Fifth, it's supporting families holistically. Parents managing their own health while caring for children, and aging parents need health care that recognizes the whole family system. Integrated behavioral health addresses parenting stress, family dynamics, and caregiving challenges as health issues, not separate problems that are somehow not the healthcare system's concern. And sixth, it's supporting community trauma recovery. Jackson County continues recovering from collective traumas: the 2020 Alameda fire, the COVID-19 pandemic, ongoing housing instability, and economic stress. Integrated behavioral health provides infrastructure for processing collective grief and building community resilience. These aren't individual mental health problems, they're community-level challenges that require community-level responses. Now, let me talk about my opinion about where La Clinica's model could be even stronger. Systematically tracking and publishing health outcomes, how integration affects diabetes control, emergency department use, medication adherence, patient satisfaction, would build the evidence base and help other organizations adopt similar models. La Clinica is doing this work, but making the data public would amplify its impact. Middle-class families often access healthcare through employer insurance rather than through La Clinica, but they face the same behavioral health challenges. Partnering with major Jackson County employers to offer workplace behavioral health education and consultation could extend La Clinica's model beyond clinic walls and reach people who wouldn't otherwise benefit from this approach. Most behavioral health challenges affect entire families. More systematically including family members in care planning and offering family therapy as standard practice could improve outcomes. Right now, treatment is mostly individual, but many problems are relational and need relational solutions. While providers collaborate closely, streamline digital tools for care coordination, patient communication, and outcome tracking could enhance efficiency and effectiveness. The electronic health record systems are good, but there's always room for improvement in how information flows and how teams coordinate. At Reimagine Healthcare, we believe the most profound innovations aren't always new technologies or treatments. Often, They're new ways of organizing care that reflect how health actually works. La Clinica's integrated behavioral health model embodies several principles central to our vision. First, whole person care. Health doesn't exist in separate compartments. Physical, mental, emotional, and social well-being are interconnected. Healthcare should reflect this reality, not fight against it. Second, prevention as strategy. Addressing behavioral health early, before depression complicates chronic disease, before anxiety prevents treatment adherence, before stress manifests as physical symptoms, is far more effective and less expensive than managing downstream complications. Third, access through integration. Making behavioral health part of primary care eliminates many barriers. No separate referrals, no additional insurance verification, no explaining your medical history to disconnected providers. Integration makes mental health support as accessible as blood pressure checks. Fourth, normalizing mental health. When behavioral health is embedded in routine care, it becomes normal to discuss mental health alongside physical health. This cultural shift reduces stigma and increases help seeking. Fifth, team-based care. No single provider can address all aspects of health. La Clinica's model recognizes that effective care requires teams working collaboratively, each contributing their expertise toward shared patient goals. And sixth, infrastructure for the future. The Behavioral Health Fellowship doesn't just fill current staffing needs. It trains the next generation of providers in integrated care from the start of their careers. This creates sustainable capacity for Jackson County that will benefit the community for decades. If you're a current La Clinica patient, ask your primary care provider about behavioral health services at your next visit. Whether you're managing stress, adjusting to life changes, coping with chronic illness, dealing with substance use, or experiencing mental health symptoms, behavioral health support is part of your care options. It's not a separate thing you have to seek out. It's already part of the system you're in. Healthcare professionals interested in integrated behavioral health can explore training opportunities through La Clinica's Behavioral Health Fellowship, launching in 2026, or behavioral health internship programs. This is a chance to be trained in a model that's still relatively rare in American healthcare. Community organizations serving Jackson County residents can partner with La Clinica on behavioral health education, screening, and referral pathways. Strong community partnerships amplify the model's reach beyond clinic walls. And at the policy level, supporting continued federal funding for HRSA's behavioral health integration programs ensures resources remain available for models like La Clinica's. These federal investments make local innovation possible. What starts as one person getting help for depression during a routine medical visit ripples outward. That person manages their diabetes better. Their family experiences less stress. Their employer sees improved productivity and fewer sick days. The emergency room sees one fewer mental health crisis. The community becomes slightly more resilient, slightly healthier, slightly more able to support its members through life's inevitable challenges. This is what reimagining healthcare looks like, recognizing that behavioral health and physical health aren't separate problems requiring separate solutions, but interconnected aspects of human well-being that deserve integrated attention. La Clinica hasn't perfected integrated behavioral health. No one has. But they've built infrastructure that treats mental health as seriously as physical health, that makes support accessible rather than aspirational, and that recognizes care for the whole person produces better outcomes than care for isolated symptoms. For families navigating the daily complexity of staying healthy while managing work, relationships, and inevitable stress, this integration makes a real difference. It means one less system to navigate, one less barrier between recognizing you need help and actually receiving it. The innovation isn't rocket science, it's common sense. When most doctor visits involve behavioral health should be part of those visits. What's remarkable is how rare this common sense approach remains in American healthcare, and how transformative it is when implemented well. Thank you for listening. If you want to learn more about La Clinica's behavioral health services, visit their website or give them a call. If you want to get involved with Reimagine Healthcare's work, visit our website. And if this episode resonated with you, share it with someone who needs to hear that mental and physical health can be treated as the integrated whole that they actually are.